Hi, this is Alina, and you're listening to Your PharmD Bestie. Hi, everyone. Welcome back to another episode of Your PharmD Bestie. My name is Alina, and I have another guest here today for this new episode. I'll have her introduce herself, but before that, let me just give you a brief background on what to expect for this episode. We will be diving a little bit deeper into what residency projects, research projects look like, and how we've navigated through choosing our projects and maybe some like updates or challenges that we've experienced throughout the year so far. So with that, let me pass it on to Abby to have her introduce herself. You could talk about like where you're from, where you went to school, and maybe a brief one-liner about what your research project is about.
Hi, Alina. No, thank you so much for having me on today. So my name is Abby. I guess the full thing would be Abigail, but I rarely go by it. I went to school at Graduate Institute, which is a smaller PharmD school down in the SoCal area in Claremont, California. A little bit about myself. I'm originally from Bakersfield, which is technically what they call Central California, but I call it Mid California because it's pretty mid, not gonna lie. But so far, since then, have gone ahead and gone down to SoCal for pharmacy school and am now up in NorCal for PGY1 residency, which is where I'm at now. And I guess my quote unquote qualifications for today would be halfway through a PGY1 residency. But no, I'm happy to be here. Let's see a little bit about myself. Other than that, outside of residency, otherwise, I enjoy kind of just vibing or existing, I guess, at the moment, or spending time with my two cats. And I will preface if you hear a cry, it is probably one of them because it is now no longer nap time. But thank you so much for having me today.
Oh my gosh, I'm sure that the listeners would love to see the cats later down the line. But thank you for that introduction. So, diving into this residency research projects as a part of ASHP expectations for all pharmacy residency programs, everyone is required to um, participate in a residency program. And I think, like, per program institution, they may have specific preferences on whether you present at a conference or present a poster of some sort. So that is where these research projects kind of come about. And of course, if you're at a large academic medical center like we are, there's plenty of ideas that are always floating around for people to work on and implement it into actual, like real practice and workflows at our institution. So that's a little bit of background on why it's important to have this research experience. Of course, everyone's goals are a little bit different, but some pharmacists may be more interested in clinical research trials and maybe they want to be published in the future. So these are different personal goals that kind of play a role in this. But on top of that, as a resident, you are also in residency to build on your communication skills, on your ability to develop a plan or a project and follow through the action steps to produce a result. So these are things that are considered like objectives in residency that we want to achieve. And one of the ways to do that is through a research project. There are a variety of types of research projects. I'm part of the admin HSPAL program, so some of the projects introduced to us were more um, system level ideas. So the one that I'm working on as an example is like implementing a vancomycin dosing software into Epic at our institution, whereas someone else may be more focused on an ambulatory care topic. Or for Abby, as an example, it could be more like acute care, or for her case, emergency department related. So I'll have her kind of talk a little bit more about the types of projects and how she ended up going with the project that she is now.
Yeah, you're right. You know what? I did forget to mention what that research was on. So my current
No problem.
research, no, you're totally right, is on looking at antibiotic discordance, or essentially the number of times an antibiotic does not match the bug that we are trying to treat in an emergency department setting, specifically for urinary tract infections, or I will call it UTI. And it's also very specific to what we call Enterobacterales, or ESBL, I'm trying to think, Enterobacterales or extended spectrum beta lactamase producing Enterobacterales. So the abbreviation for that is ESBLE to avoid that mouthful for sure. Within that, we're trying to look and see when a patient first comes into the emergency department and they receive an antibiotic empirically, if the cultures that result anywhere from 24 to 48 hours later do show the first chosen antibiotic was susceptible or if it was not. So, for that project, we're really trying to go ahead and assess if there is an increasing number of these resistance patterns in primarily our Klebsiella species or our E. coli species to see if those first line antibiotics we're using are no longer as appropriate or what populations we might see an increasing number of these resistant factors and if we should start changing what our empiric guidance might be depending on the population we're looking at. The importance of this is that we have had a few studies that have gone ahead and been released essentially, even in the past couple of years or so, where they show that even a couple years ago, it might have only been like a 5% incidence of ESBL, but the more recent ones have shown that there might be anywhere up to like 20%. And it does depend on location. So there was a trial that was released from a Kaiser joint effort between NorCal as well as like MidCal and other areas. And there was another one that was released or performed across the nation. Both of those have shown some mixed numbers depending on your location. So we wanted to go ahead and assess what it kind of looks like in California specifically, using our large academic medical center to go ahead and collaborate with some of our sister sites to go look further into this information. Now, that's just one of them. The actual type of project this is more of a retrospective study. So we're just going into the past and looking at EMR or our electronic medical record charts to find this information. And that is one type of way to do it. I will preface that because it's such a large project, we also have some data analysis or analysts on board who will develop what we call data codes or SQL codes or like a sequence code that automatically pulls the data. So my project does not have what we call like data collection that you would perform manually. So typically as a resident, especially in a PGY1, you're going to have to go in to your patient charts, most likely for retrospective studies, to try and find that data on your own. However, my project is a little different, so I can't speak to that as much, but I can speak to some other things I would have chosen for it if I could go back and do it again, and what I would definitely encourage future PGY1 residents or residents in general to choose or look out for in their choosing of future research projects.
Yeah, I think that would be really cool to get some insight on later down the line. But thank you so much for giving a background on what your research project is about. And like as you can see, for listeners, this is like a prime example of someone who like has really spent time into their research and like understands it really well and understands the impact of it. And I'm sure that when this project was introduced to us as a potential idea, it probably wasn't as well developed as what you heard just now, right? Like a lot of it is you have the idea and you have to come up with what are the inclusion exclusion criterias, what are the measures that you are looking for to make sure that this project does work well and that it aligns with not just like your goals but also with institutional goals. um Abby, could you talk a little bit about like your particular goals and like why this project stood out to you?
Yeah, no, to preface, I am very biased when it comes to emergency medicine. So I am accepted for a PGY2 in emergency medicine right now, and that has been my goal since the beginning of my PGY1. So if we go back way to me in like June and August, whenever they were asking us what research projects we wanted to do, what one drew my eye was what's something in emergency medicine or in a future interest area of my choice. And then two, what's something that seems like a team has thought about this well and kind of has an idea of what they might go ahead and look for already in charts if applicable. The other thing for me at the time, not knowing anything, was they also mentioned how you don't have to go and do chart review. They're like, "Oh, this is an automatic data pull." And, little Abby at the beginning of residency was like, "That sounds great. I don't have to go and pull data. What a time saver." Then I thought I could dedicate more time to my rotations. Hindsight, I will teach you later, is not so positive, but everything has its pros and cons. The other thing that really drew me to this was looking at the involvement or essentially the record of the preceptors. So essentially, I tried to look for someone who has done other research projects before and was successful about it. Another goal at the beginning of for me was publication. So I tried to inquire with who we have on our team as like a research coordinator of sorts or research mentor of sorts in our what we call PROC, which is like our research committee, to ask them for their insight on, oh, do you know who amongst these preceptors you would trust to go ahead and have uh, essentially a reliable record of one, getting a research project done on time, because you are going to be limited by that 12 months. And it really might be more like 6 months once you consider the fact that you have to get it up and running and also be done before the end of residency. And then two, have they published in the past? And three, do you think they're going to go ahead and keep me on track or provide good support for this project? So I try to consider all of those factors when I'm going into it, just aside from the fact that, oh, it's an emergency medicine and I just really like that topic. The other thing I would encourage is looking at variables. So, whenever I was looking at these different projects they offered us, I wanted to see how many different variables are there, because if there are at least 10 or 30 different variables, how long is it going to take me to go ahead and collect data for even one of those? 1 minute, two, 10, 30 minutes? That can really start to add up. And again, your time is going to be so valuable when you try to go ahead and navigate absolutely everything going on in a residency. So try to find something that's also time sensitive or can be time efficient for yourself. And really, if you can get a lower number of variables and still be able to effectively go ahead and answer a very specific question, I would highly rely on that rather than having a lot of background data that you're not going to truly use in the end of the research project, anyways. So, those would just be some of my tips and goals for looking at a new project.
I think you bring up a lot of really great tips and points. Me myself being kind of like a newbie to like research, and like granted admin's like a little bit different too, but like going into the project or going into like selecting the research project, like I think I heavily focused on like what appealed to me without realizing and like considering all these other different factors that you had brought up. The first project that I actually was doing was about measuring the impacts of an AI tool that we use as part of like my chart at UC Davis, and it basically sends like reminders about like prescription pickups, et cetera, to like patients. So more on like the outpatient side. And at first I was like thinking about this and I was like, wow, this seems like really cool. Like I want to be involved in this. And I chose it, but I didn't consider like how well thought out it actually was, like who is the preceptor, um, or the advisor for this project, like how committed can they be to supporting me through this? How long will this project actually take? And like what data do we actually have access to? Is the question at hand, the study question, the hypothesis, is that actually something that's even like feasible to measure? So long story short, TLDR, like my first project didn't work out. And I was already like late. It was already like late December by this point, and I was like, I have to restart. I don't even know like what other projects are available anymore. And so it was a lot to kind of like reshift my attention to like something else and then work with like leadership to come up with like a different project. But I think everything that you brought up just now is like so important to avoid having to go through something like that. And also the aspect about choosing a project that has like as little variables as possible to still effectively and successfully answer the study question is also so important. Um, Backing up what you mentioned about like your time is so valuable, at least the last thing you probably want to do is be spending 40 hours trying to do like manual data collection or like looking at all these like extra variables that may not even be necessary to help answer your question and for publication. So I absolutely love all of those tips that you gave. Thank you so much. And I think it'll be very valuable for listeners as well. So that being said, I think I kind of talked a little bit about some challenges that I've faced with research so far. Um, Were has there been anything during these last couple of months since we started the research project that you found unexpectedly challenging or that you had to navigate and maybe looking back, like you wish you had approached it differently?
There have definitely been challenges. I would probably say one of the bigger ones was kind of going into this and thinking that a multi for so specifically for my project, I mentioned how it's a multi-site project. So we are collaborating with sister sites to go ahead and collect more data. Now, on a surface level and from a publication perspective, more data sounds great because it gives you more power to go ahead and trust the reliability of the question you're answering. The other big thing that I thought was grand at the time was that this study only, or my study right now, only requires descriptive or statistics. So we essentially are only looking at just how many people or what is the rate of discordance. So it's like a mean, so like an average. There's not really much else we're doing with this data. We're not doing any comparisons. There's no like control or variable group. So that also on a surface seems nice or more simple to go ahead and complete the project. If I could encourage something by stepping back with the wisdom I have now, I probably would say one, do a single site project. A multi site might sound grand and it might sound appealing in the moment, but you are going to hit some roadblocks of trying to navigate purely how to go ahead and set meetings with people. Like everyone's schedules are going to be very different. So for mine, I have three other sites I'm coordinating with. So it's those residents, then their preceptors, then their data analysis, or that we need to go ahead and contribute as well as other people that we've now looped in on the project who are also going to go ahead and be a part of it. That's also not including the students that are then assigned to us to go ahead and help out as well. And once you get to that point, that's a lot of schedules to try and go ahead and manage. You also start to lose some autonomy. For example, a couple different times throughout my research project, I might have had like oh, I think this is a great idea moment. However, if it doesn't translate well to the rest of the group, you might not go ahead and get that through, or you might end up having that be something that gets done or suggested for a future project. That's not always a terrible thing. There is such a thing that I would caution people against, which is called scope creeping, which is where you have a research question, but then as you go through the project, you start to have all these other questions of, oh, wouldn't this be grand or wouldn't that be grand? But you really need to emphasize in some of those situations of, should I reevaluate? Should this be a future project or a future publication? Because you can't do everything in one paper and you're not meant to. So I would go ahead and I would truly try to caution people against scope creeping. Answer one question. So I've given you two tips so far. Answer one question and go ahead and try to do a single site project so you can have some autonomy as well as an easier timeline to get this completed. If I could emphasize one other thing, looking back, I'd go ahead and say try to pick a flipped model. What is a flipped model in research? This is where the people before you or the residency class before you has already picked out a question, has already gone through a slicer dicer or essentially looked into your electronic database, found patients that do qualify for this, have already submitted what we call an IRB, or essentially it's your institutional review board that says, yep, you're okay to go ahead and complete this research. And all that's left for you to do when you start and first come into residency is just to collect that data. Everything else has essentially been prepared for you. Why do I think this is a better model? One, you don't know that much when you first come into residency. So being able to only collect data gives you a chance to kind of see the process, get familiar, but still stay on track and be pretty efficient because data collection at that point should be relatively straightforward. Two, you then to go get to go ahead at the end of the year and then go ahead and make your own research question. I think that's a great way to go ahead and finish off your year since you have a much better understanding of what a research project looks like and all the little weird tips or tricks or things you would avoid, you now know by the end of the year and you can set the next person up for hopefully great success. So if I could go ahead and do that, I would have gone ahead and picked one of those projects instead. We did have a couple offered at our site, and thankfully those people seem like they're doing really well this year in those projects. The other thing I would go ahead and mention now as a reflection to go ahead and avoid is again having that realistic timeline. So, in order to have that set in place, I would emphasize having a SMART question. What I mean by that is a specific, a measurable, a realistic, and a time sensitive question. Something else specific to my project is that I wish I'd gotten my IT analyst involved sooner. So, what comes with that is that other people in your project might tell you, oh, don't worry about this, like it won't take that long, things are going to go okay. I mean, that is a false sense of security in some aspects because it is going to be much more helpful to be very proactive on a lot of this. Since it's going to be detrimental if your only barrier to getting something completed is I just need a piece of paperwork done. So I would definitely emphasize trying to get that IRB done as soon as possible. If you have something that seems kind of wonky, like for myself with my data, if you need a data analyst to go ahead and create a whole computer code, get them involved sooner. At this point, it's now February and I've now involved somebody, but it might take anywhere to a month or 2 months for them to go ahead and get the data turned around to me. Now, if I were someone who had to still go ahead and perform data collection, that'd be a big uh-oh, especially coming up in February when we have a presentation in May that's going to get completed. So I would definitely warn against trying to be a little more lax on trying to get these things done. Be as proactive as possible. So those would probably be some of the goals I'd set for people and kind of the pitfalls to watch out for going forward.
Once again, like I think you hit it on the nail, like with a lot of these, kind of reflecting like on my own experiences so far with my research project. Like it's so important to be proactive and stay on top of these things because like again, I did not realize that um even waiting for IRB approval can take so long. Even like waiting for data to be returned to you or like to be pulled from like IT analysts, like that can take months. And so you have to keep in mind like at the same time you should probably have some like buffer periods like inserted for yourself to work on like other things that are required for residency and also just like a lot enough time for you to complete the actual data collection itself, the data analysis itself, write the manuscript. Like all of that on top of that, like definitely making sure that you are aware of the timeline and how fast paced things actually are and how short a year actually is to successfully complete your project. Especially, like Abby said, if you have to start from the very beginning, where you have to get the IRB approval, where you have to like come up with the study question yourself, and it's not already kind of preset for you by prior residents. So all very lovely tips. I I honestly think you like mentioned a lot that I would also um want to advise future residents as well. So definitely if you're listening, like I think those are very important things to keep in mind. Um that being said, like, I'm trying to think other things that I wanted to also just briefly run over to inform listeners. We talked about how there's different types of projects, but outside of like residency research projects, like some of them are also more like qualitative improvement projects. And so sometimes those may not require IRB approval. That's also something to consider as well when you're selecting your project that might help with saving some time for you. I'm also trying to think, we also have like other longitudinal projects like our medication use evaluations, MUEs, or like monographs that also kind of may follow the same timeline or the same kind of step by step process where you have to submit an IRB, you have to do data collection or not. But that is something that I just wanted to bring up as kind of a warning that there are other areas within residency where you have to apply these skills that you learn and these lessons that you learn with your research project to succeed and to graduate from residency. Do you have anything else that you want to add, Abby, for like anything that we've talked about or anything like last minute takeaways before we conclude the episode? Because I feel like this is a really good like intro and background for research projects.
I think you definitely hit the nail on some of those other longitudinal ones to truly watch out for. I am not familiar with how different health systems who might use Cerner or essentially do not use Epic go about their data collection, especially when it comes to just running a quick power analysis to see, hey, can I really quickly see how many patients I would need in order for my MUE or my research project to more so for a research project to reach power? And that's more of a double check for yourself of do I need 50 patients, 100 patients, 500 patients? Because that would also go ahead and impact your if you're doing manual data collection, how many you're doing. But then for an MUE, just to see, like, how about how many patients can I get in a month or in 2 months? If they want me to look at, like, about 40 people to answer a quick, again, very specific, question to go ahead and help, like, the site itself. Other than that, I think we've kind of hit it on a lot of it. As as you said, it's a warning. It's just like a heads up. It's like a, "Hey, this exists." Make sure you just you know about it. But
Yeah, I think these are things that like I wish I knew like going into residency. So I hope that listeners find this very helpful. As a recap, like we've touched on a lot of things, whether it's how to choose a residency project, all the different variables and factors that you should consider when you are choosing it, being aware of the timeline and complexities of the project that are beyond surface level, and just being able to adapt when things don't go as planned. I think that's also very important. Something that honestly, I think you can really only learn once you actually face that obstacle or challenge. And yeah, I think lastly, also just maintaining communication and realizing that this is something that everyone has to go through. So you aren't alone in the process. But there are ways to definitely navigate research projects so that you can come out on the other side more efficient and successful.
for sure. No, if you can go ahead and try to set those meetings way in advance, it will definitely help you out for the future. And I would say if you are in a project where you have to be with other people or collaborate, like don't be afraid to stand up and use your voice, even if you keep getting shot down. At some point, you may end up being right. And you'll be the one that was like, I tried to help us out earlier. But no, then you are in a position where you have the answers and like you've already kind of thought of a solution for that. So don't stop thinking, don't stop using your head. If I could have one other weird tidbit is that not everyone is blessed to have a data analyst at their sites. At ours, we are blessed to go ahead and have someone who will run that data, do the analysis for us, and then kind of give us back the results. If you're not, I would recommend looking at projects and just doing a quick check of, hey, could I look up a YouTube video and do this in Excel on myself? Like, is this just an ANOVA test where Excel can run this for me if I click a couple buttons? Also, like other strange shit for those who might be in different situations than our own. Something else to think about.
Yeah, definitely. Thank you for adding that little tidbit. Um, with that, I think we are at the end of the episode. Things that we wanted to talk about. For listeners, thank you so much for joining us for another episode. If you enjoyed this episode, please feel free to leave a subscription, leave a review or comment. If you have further questions, feel free to DM me as well, and I'll do my best to answer those in future episodes. I also really want to give gratitude to Abby for joining me for this episode as well and giving a lot of valuable tips. I'm definitely looking forward to seeing how our research projects end up by the end of the year. But yeah, thank you so much again and hope everyone has a great rest of their day. See you next time.
Thank you, Elena. Thank you, everyone, for being here.